So Chip, is that your code number?
Beats the heck out of me. I don't know how that got up there. I'm gonna just do that. That's my new prison code. You bet.
Looks like a pretty nice prison. Wood paneling.
I'm locked up. Whatever.
How's everybody doing? Good. Let's get this meeting going. Good to see everybody. It's been a couple of weeks, and it's good to see everybody on. Of course, first thing we want to do, and I'm ready to hear from Dr. Ryan, because what I'm hearing on the news really is starting to trouble me and what might happen going into the next several months. I mean, it's almost scary what I heard on the news last night. So with that, Dr. Ryan, could you give us an update and some thoughts for this group this afternoon?
Absolutely. Thanks, Mike. Hello, everyone. In a nutshell, we're headed in the wrong direction. We have half the country who's still unvaccinated, significant portion even in this state. We have more than half the counties at below 40% vaccination rate. So we are not like any other, or we are like every other state in this country in terms of our potential risk. Cases have gone up literally for the last 3 weeks straight. And strangely enough, hospitalizations have gone up in sync. There is no longer that 3-4 week delay that we have seen historically in the past. It is in unison rising. So that's a reality on the ground. The Delta variant and the unvaccinated are the ones driving this current surge. And with half the country unvaccinated, the potential growth for this surge is enormous. So Mike, you should be concerned. I am concerned, and I probably know as much as anyone of what potential is out there. Right now, we have 14 active cases in this county. We haven't seen those numbers in many, many months. It's predominantly in the unvaccinated. We do have some breakthrough cases, although having said that, the difference in symptomology and outcomes between vaccinated and unvaccinated is night and day. Vaccinated have cold-like symptoms for a few days and life returns to normal. The unvaccinated, the story is very different. Very ill, weeks on end, everything you would imagine. The Delta variant is a game changer in that it is far more transmissible. The CDC came out with something on Friday equating it to chicken pox. Highly contagious. So it no longer requires a 15-minute non-masked interaction. It's why you're seeing breakthrough cases. That when you live with somebody who's unvaccinated and you're vaccinated, the duration of that exposure is so great. And another, I would point out to everyone, the vaccines that you've received have never been declared 100% protective. They're 90 to 95% at best. So exposing yourself in risky behavior, meaning going to a concert with 22,000 of your closest friends, even if you are vaccinated, even if it is outside, you are in incredible close proximity to many of these people. And the need or the amount of time that's needed to give you COVID is minuscule compared to what it used to be. It's why you're seeing cases in the spike that we're seeing now, even among vaccinated. So strongly encourage everyone to get vaccinated. The symptoms you might feel from a vaccine are nowhere in the same realm as what you're going to feel with COVID. What I would suggest to this group, to business owners, is this. And I know I'm preaching to the choir when I say this. Staff is few and far between. So I would do everything in your power to keep that staff as safe and healthy as you can. At this point, I would mandate masks for all employees, regardless of vaccine status. The patrons, I understand and fully appreciate the challenge with patrons and trying to get them to wear masks. It's a lost cause at this point. It isn't a battle worth fighting. And to be quite frank, those people don't live in our county. Your employees, though, are going to be coming back. They either live here or work here. So keeping them as safe as possible is in your best interest. I think you all know that and can fully appreciate that. And given with the number of breakthrough cases we have had, I wear a mask in here because we have unvaccinated people. So I do everything I can to protect myself and my staff. We all wear masks wherever we go. So that would be my recommendation to you all. I don't see this ending anytime soon with half the population in this country unvaccinated. The level of misinformation out there, just in talking to people, what they believe to be true is on a whole new level, the likes of which we have historically never seen in this country. Just absolute nonsense, non-fact based fear mongering, and how quickly people are happy to hear that, but don't fully appreciate the facts and the truth. They dismiss it with all their nonsense and misinformation quickly. Some going so far as to claim they have either a medical degree or a PhD, calling themselves doctors, when 95% of what they said is actually factually not true or even remotely true. So we're entering a new realm. Any questions?
Any questions for Dr. Ryan so far? All right. You got more for us, Dr. Ryan?
That's it right now. Unfortunately, the state, my portal for data is temporarily down and has been for 5 days with no end in sight. I know through the nurses, though, our case counts are climbing as they are through across the entire state. So as you're all aware, all public health measures have been pushed to the side and are what are fueling now the spike in cases that we're seeing, right? You have unvaccinated people who are not protected in any way. Chip, or 105-687.
I like that better. I'm gonna adopt that permanently. Is there any chance of getting a county mandate again? At least you could mandate, because as a business, that would make it so we could have customers come in and require masks. If it's not mandated from some government entity, that obviously won't work.
Yeah, that's a question I think better for George and myself, as he's the one who would, one of three that would decide that. We have mandated them for county employees who are unvaccinated. And I think we're going to be changing that to anyone. All county employees need to mask up. So that would be my recommendation, but above my pay grade.
There you go. George just got put on the spot.
Yeah,
Welcome to our meeting, George. Have you and the other commissioners had any discussion about this with public health? And is there any thoughts or direction that we might be seeing going into the future?
we had a very brief conversation on it. And I'll speak for myself. I don't think I'm in support of us being the only county in the state with a mask mandate. I do, however, support the concept of a mask mandate in the context of what's going on right now, and think we need to put together a regional approach. I know Tim and I tried that when the mask mandates were falling down this spring. Didn't really get anywhere. I'm thinking with these headlines, and I'm seeing tones change from public health directors all over the metro area and in the resort communities. I'm hoping that we will see some will for a regional approach to come back, because I do think we need this. The way I view it, if we can get a mask order that starts to tamp down this growth in these cases, then we don't have to do the other stuff that we don't want to do.
Yeah, I mean, we were the first county to mandate all unvaccinated county employees wear masks, and that went off without a hitch. And other counties have followed suit. It's okay to be the leader sometimes. And so I think what I'm doing, because I don't think there's, and I don't know any other word for this, the political appetite for that at this point across the entire country. So rather than try to fight that battle, what I've done is approach it from sort of the low-hanging fruit, right? Unvaccinated county employees, now all county employees. I'm encouraging businesses, right? You have, as the proprietor of your business, full right to mandate anything in your business. It's your business. If you don't want to do that and it isn't your business, I'm happy to take over the business if you want to will it to me. Any one of you on this screen, I'd be happy to take your businesses. So you have the ability as the business owner to do that, to say to your employees, it's in our best interest as a company to mandate that you wear this mask to help protect you, the employee, my employee as the proprietor, right? So it's sort of that low-hanging fruit, so that we don't have to get into, to George's point, we're the only county doing this, or businesses don't have the ability, for instance, to enforce it among their patrons. I fully understand and appreciate that. So I'm trying to make it so that isn't your reality. Your reality is to protect your most valuable asset, and that is your employees at this point. Because without them, you're not in business, right? So I'm trying to approach it from that way, as opposed to trying to put George on the spot or others to say you need a mandate across the entire county. I'm trying to cherry pick what I can as the low-hanging fruit to make sure that we're protecting at least our workforce across the county, both in the county buildings, but also in our private businesses. So.
And in this setting, I don't know if there's time on the agenda in this setting, but I welcome your thoughts on what I just had to say. Want to get this right. Your intelligence.
And I agree with you, George. I mean, Clear Creek can't be the only county. I don't think it hurts to lead, but I think taking a proactive stance and getting the other counties involved and going this direction again, it's not going away. It's only getting worse. It's getting worse really quickly. I think we need to act sooner rather than later.
Has there been anything from the governor's office and what Governor Polis may be thinking and our state public health? Have you heard anything on that, Dr. Ryan, or is Governor Polis just trying to kind of standing back?
I am not in the business of projecting what he may or may not be thinking at any given moment. We never know.
I'd be very surprised if we saw a statewide mask order.
Okay. All right. Questions from the group?
Well, I'm contemplating the offer of being willing to business to you. If you really want to.
Wait a minute.
Yeah, we'll get Westbound in there too. You can have both
Y'all
breweries.
need to get your butts in line, okay?
Yeah,
Y'all
you wanna
breweries,
say-
boy, that would be a dream come true.
Yeah, some long hours and low pay, high stress, working a petri dish.
Oh, it's fantastic.
All right, Ed, you talking about
Steve.
losing employees. What employees are we going to lose? We don't have any.
Steve, what do you think I've been doing for the last 18 months?
Yeah, I'm talking longer hours and lower pay. So yeah.
Okay, well, Dr. Ryan, thank you for coming, giving us the bad and the good and the at least acknowledging and kind of giving us and keeping us, with a heads up of what could potentially be happening as we move into the future. When I saw the Lollapalooza with 250,000 people at it, it was just like, man, this could be bad with that. And then I think there was some event up in Cheyenne this weekend or something, but I won't go there. Oh, sorry, Andy.
Yeah, it will be. And so I have a question to George's point, right? You all know through experience already how difficult it is to get your patrons to follow any mandate. And most of you are restaurateurs where the people in your restaurant aren't wearing a mask the majority of the time they're there, right? So would a mask mandate across the county, I understand you now have the authority to say, hey, it's not me, it's the county that's mandating this, so you have to do it. So is that the more of an appeal? Because if we do a countywide mandate, it's going to create, in addition to solving some problems, it's going to create additional problems that we've already lived through, particularly around patrons. So which would be more effective, I guess is part of George's question too, for you all to help protect your businesses and your employees, as opposed to creating more frustration and more problems for you to deal with patrons with less than ideal.
Oh, I think it would be much easier for us to require our employees to wear masks. I think that's where we should all think about starting right there, as employees wearing the masks. We already have the option to enforce. We can tell people, you know what, you can't come into my business without a mask on, whether it's city, county, or statewide or nationwide. Every business owner and operator has that opportunity. Of course, we saw what a mask mandate did to our businesses and what another one could potentially do. So I really appreciate you saying, Dr. Ryan, first things first, put the mask back on the employees, vaccinated or not. It makes sense. The other thing, we had a discussion in our staff meeting this morning. We may even consider going back to Zoom meetings. We just started up 3 weeks ago, with meetings back in person to try to get some normalcy back and to have our members of our community, come in and speak to us, when we have public meetings and things like that. So we have already had that discussion this morning, whether we may just go back to Zoom meetings again, on a temporary basis until we start seeing what's going to happen with this new variant. when I hear, you know, Floridians and Texans and having more hospitalizations than they did with the first round. That's concerning. Mandates from some communities that they're required to build more COVID hospital beds within their hospital because they're expecting this to, and before we had parking lots setting up these vaccination clinics, these hospital clinics. You know, what do we have in Denver? We had the event center had it all set up for a hospital bed after hospital bed. You know, I don't want to see refrigerator trucks being parked outside a coroner's office to put bodies in. You know, it's just, just crazy hearing this stuff again.
Yeah, tell me about it.
All right, last opportunity for any questions to George or Dr. Ryan.
One other thing I would add, we are continuing to have our vaccine clinics. We will have only 2 this month, primarily because we're moving from one location to our new digs, but are continuing to have those on Wednesdays. Are making some progress. We've climbed 0.5% in the last week, which is fantastic. But it is not nearly the numbers that we need to get us up to where we need to be. We're at 64.4% or so.
But
So,
testing, is the testing still as frequent or?
yep. Good question, Marcel. So testing, actually, we saw a huge spike last week of folks being tested. We have had testing every Tuesday from 10 a.m. to 2 p.m. It's between the bus barn and the old football field. COVID Check Colorado, it's free, no appointment necessary. We've had 6 maybe per week. Last week we saw a jump to 35, which is a huge spike, and it really follows the cases, right? People are interested in knowing if they are in fact positive and going getting tested. So
I'm considering making my unvaccinated staff get tested very frequently. Unless if you're vaccinated, it's fine. But if just
that's and that mirrors what the school is going to do for unvaccinated staff. They're going to have to get tested twice a week. And testing will be available in the school for them, primarily because the sooner we know you're positive and get you out, particularly if you're asymptomatic. So
do we still have and this, I could be remember something incorrectly, but wasn't there a take-home test at one point that we could have, or did that never actually?
Here's the challenge we're running into now. The state invested tens of millions of dollars in a test that is woefully inadequate. It's 40% accurate, and you need to do it serially, meaning you literally need to do it every day of the week for weeks on end to hopefully find you when you're positive. I've never been a subscriber to that. I thought it was a bad idea before they spent tens of millions of dollars, but here we are. What people are doing now, though, is you have the ability to go to CVS or Walgreens and buy an over-the-counter test. The problem with it is, unlike a pregnancy test, that is not a reportable situation. Pregnancy, the state doesn't care that you're pregnant. The state needs to legally know when you are COVID positive. It is a communicable disease it's required by law that you report it. So what people are doing now is going to CVS, Walgreens, testing themselves, finding out they're positive and telling no one. So our numbers are actually an undercount of reality, right? People aren't going to the test site because they don't want anyone else to know or whatever other reason. So right now we're going to be having, we have testing continued in the jail. That's ongoing. Testing will resume in the schools once school starts up again. And then on Tuesdays from 10 to 2. But in addition, at the fairgrounds in Golden, they have testing 6 days a week available for free, similar to us, free of charge, no appointment necessary, just show up and you can get tested.
Okay, does that answer your question, Marcel?
He looks frozen.
He is frozen. Imagine that, Marcel, where he can't speak. All right. Maybe I don't know if he can hear us or not. Okay. Thanks again, Dr. Ryan. So let's jump in real quick. Just businesses. Tell us about the last couple of weeks, what you're seeing, how are things going, and do you have any things that we may need to start considering as we start to wind down summer. A couple more weeks are Clear Creek School. Oh, I was going to ask that before you left, Dr. Ryan. What is the future and the precautions that we're taking with our school district at this point?
Good question, Mike. What we're doing is masks are mandated, top to bottom, K through 12, all staff, regardless of vaccine status. So as far as vaccine status on our staff, it's roughly 70 to 75%, which is really good. And then the unvaccinated staff will need to be tested twice a week. That will be done at the school. Masks for everybody. What else are we doing? Basically, similar protocol to what worked for us last year. With our stated goal of education is the first to educate kids and keep them in school every day they can. My goal is to keep them as healthy as possible. So in order to do that, we need to wear masks moving forward until we can get the student body, which is now below 40% vaccinated, well above where it is now. And only then could we can possibly consider going without masks.
Is there going to be any social distancing requirements?
So in the school, a little bit less than we did last year. We're trying to make the process as minimally impactful as possible. Given that we now have 75% of the staff vaccinated and roughly 35 to 40% of the student body, that will have an impact on transmission. But really relying heavily on masks and hand washing and symptoms, just self-identification and not going to school when your kid is sick and that sort of thing. So not quite the social distancing we had last year. Cohorting during lunch, similar to what they did last year, it was really effective, that is really their Achilles heel, given that all the kids are mask free at that moment. And we have socially distanced them. So there are now 3 very distinct, very large areas where kids will be eating their food or their lunches.
Okay. All right. Thanks for that, Dr. Ryan. Okay, Steve, give us an update.
Yeah, there's definitely a mask angst going on here. I get asked several times a day if we're going to have to wear masks here. And my pat answer is, if things go the way they are, yes. So I've gotten that far. I'm pretty nervous of trying to implement a mask policy here, but that was before this conversation. I guess I'll have to sit down with the managers and seriously debate it and figure something out. Business is good. Outdoor seating is still the most requested thing. It seems to be full all the time, even when it's raining out. People are sitting in the tents out there. It's kind of interesting. The new street end barrier looks really good that CNC made on the west end of the street. Good job on that. See, last night we had the Super Spreader Rapid Grass Festival. That was a really positive event. It was overwhelmingly successful as far as turnout and the way that it was organized, and Sadie did a great job of putting it together with the help of Mark. It was one of those events where everybody there was having a really good time. People needed to get outside and be social and be at a music event, but you feel a little guilty saying it after this conversation. But it was a good event. The no parking signs on the south side of our building seem to be working really well, because I watch it in the camera. I can see from my desk here, and the flow of traffic, there's a lot less stop and go traffic out there, and people are being able to walk up and down that area without looking like they're going to get run over all the time. So good job on that also. Then 2 weekends ago was the Mount Evans Hill Climb event. And that was, normally that's on the west side of our building. They block off that whole area. and everybody was kind of disgruntled about doing it over in the 103 parking lot. But that day I was in charge of working it, and I was running back and forth. And every time I go over there, it was a nice, peaceful, good event. And every time I came over here, there was this almost hostile feeling in town with parking. People are just circling and circling, and it's super competitive and not a good vibe, at least on that day. And certain days, if you don't have a parking spot. And so I was, they were all bummed because they wanted to be over here. I'm telling them it's actually nicer over there as a calm, off. It's not hostile environment. It's really weird how it just is a pressure cooker in town here, and you have people circling with trailers and campers, and there's nowhere for them to park, and nothing you can do about it, of course, right now. But just an interesting observation. That's all I have.
All right, thanks, Steve. Chip, give us an update.
Okay, well, business has been good. Things are going well in summer. If we could get more staffing, that'd always be good. We did initiate a masking policy for all of our staff. Let's see, it went in Friday or Saturday. I'm not aware of much backlash on it. I'm seeing, just walking around, I'm seeing a lot more people wearing masks. A week ago, I didn't see anybody wearing masks, but I'm seeing a lot more masks around. One of the things I kind of wanted to mention to this group is I went down to Old Town Arvada last week. Met one of my daughters down there for lunch, and we're walking around, and they've got their streets actually blocked off. They've taken it even further than what we did. One of the things that I really noticed, though, that I wanted to bring it up, is they closed off their sidewalks. So the places that have got seating outside or whatever, it extends from their building all the way out into the street. It's much more integrated. And if we have the street closed off anyways, I'm not sure why we need to have the sidewalks open. So it really makes, I think, a lot more serviceable for the restaurants to be that way. It looks much more integrated, like it's all kind of planned. Tommy Knockers and Westbound and Down, you guys did really good job. Some other people, quite honestly, I'm embarrassed for what we did, but we'll do a better job next year. But that's just one of the things I wanted to throw out there and let everybody think about it.
I believe, Chip, as we talked about this with our legal, it was recommended to leave the sidewalks open. And I think that's the reason that we did that. We didn't want tables set up out there and things like that.
Maybe it should be revisited again now that we've been doing it for a year and a half or so. Again, I was kind of looking at where we used to be. The street weren't open, and we're taking it from, I think, a little different perspective. So I understand why they did it. I'm just thinking that, maybe it really wasn't necessary, but.
Wouldn't Main Street comply to the ADA criteria? Because there's plenty of room out there. That's the big holdup for us, is walking across the public sidewalk with beverages and beer, alcohol, and then the cross traffic for our wait staff can be challenging. And we have talked about this several times before, of trying to set it up, because that's the way it's done everywhere in Europe. It's an extension from the front of the building and then the walkways in the street.
Andy?
I think one of the big concerns was assuring accessibility to all businesses. And if you close down the sidewalk, as we know, the only ramps are at the corners. So, for instance, if you're mid-block and you have a business, not a restaurant necessarily, but some sort of business, if you don't have access down the sidewalk, you're not going to have ADA access. You're not going to have ramp access. So that was one of the main driving forces for at least for now, for trying to keep the sidewalk open. I believe, and this is not a teaser, but I think Cheney and her group might have some ideas about how to address this moving forward.
And that's what I was going to go with it. I was going to go there with it. So, all right, we'll definitely consider that. Marcel, update.
Sorry, having computer issues. There we go. Whoa. All right. Everybody hear me okay?
Yep.
All right, good. We are doing okay. And I like the discussion about the streets. Obviously, you know where I stand. I think the streets in front of our establishments are benefiting from being closed. We're seeing an increase in foot traffic. I mean, everybody's posting numbers better than they've ever done, which is, great. We're getting to the top of the mountain. We got to get back down. Trying to keep our staff intact and stuff. That's the big challenge for me. Working on adjusting some hours and keeping the products going out with a lot of quality. But all in all, same thing everybody else is saying. I'm seeing a lot more masks in town. I know my staff won't be crazy about wearing masks again, but they'll do it. I am going to, it's all going. I am going to start making people that aren't vaccinated just get tests every week, and it's as to protect my business, and that way it's if they become positive. And Dr. Ryan, all the quarantine laws are still the same, correct? Excuse me, quarantine suggestions are still the same. It's you get somebody that's positive and you get exposure unmasked. That means you need to stay home for 10 days.
So it's things have changed a little bit, Marcel, and a great question. And my staff and I were just talking about this earlier today. If you're a vaccinated individual and you have and what we're seeing now is really play out in people's homes when you have unvaccinated people living with vaccinated people, because the duration of exposure in that scenario is much different than a casual interaction you have with a stranger on the street or in your business, right? And that's where we're seeing the majority of breakthrough cases where you have that level of exposure at home. So in the case that you're describing, if you have a known unvaccinated employee who has a direct exposure to a positive case, yes, they need to quarantine for 10 days.
Okay.
For vaccinated individuals, that is different. Right now, what we're doing for vaccinated individuals, if you live with someone who's unvaccinated who becomes positive, you have to quarantine even as a vaccinated person. We're trying to figure out what duration that is. It's shorter than 10 days because Delta shows up much quicker in the 2 to 3 day range as opposed to the 5 to 7 day range that we were waiting before. So we're going to come out with something here in the next week around that. But unvaccinated people, yeah, same. If you're exposed to a positive, you're quarantined
10 days.
for sure.
All right. And then our masks are going to hold some weight on that. Is that right?
Masks or what?
Masks are going to hold some kind of.
Oh, absolutely. And let me just be clear to the whole group. There's no one that wants to get rid of masks more than I. I would prefer society back to where we are, but the reality is we have hundreds of millions of people who refuse to do anything in terms of getting us through this. So it is not my choice to want to wear masks or to want to do any of these things. I would rather have a vaccinated society, and this would have been over months ago, but here we are. I didn't create this. I have to live in this unfortunate reality that others created and continue to create. So if you have a mask on and that level of, or you have an exposure, obviously you're vaccinated, you won't have to quarantine at all. For unvaccinated individuals, again, it's going to depend on, are you wearing a mask or not? Was that exposure inside? How long was that exposure? These are the things the nurses will ask individuals. That will play a huge part in answering all those questions, will play a huge part in whether they have to quarantine or not.
Okay. And then the testing facilities here in town, right? Tuesdays.
Correct. It's Tuesday from 10 to 2. It's free, no appointment necessary, just show up. It's between the bus barn and the old high school football field.
Yeah, you're going to see a lot of my employees in the next week.
That's fine.
Yeah. Okay. Great. Yeah, and then that's the gist of it. I mean, we're sailing along. We're doing okay. I feel very fortunate to have the staff that I have, and I'm grateful that they're trusting that we're going to get through this together. Everything is, going well. So, and again, I would like to state on the record, I'm very proud to be a part of this community. I think that Idaho Springs and Clear Creek County is doing a great job at being very proactive at dealing with all the stuff that we've been dealing with. I think that we're only getting better through all of this, not worse, which is good.
Hey, Marcel, I might add that if you're sending a number of employees over to the testing site, I'd recommend you go online to the county's website and register. It'll save some time because you don't have to fill out the paperwork on site, and you can also request an appointment. So that might help spread it out and save some time for your employees.
Okay, good. Thank you.
Chip?
Marcel, I think that's a great idea about getting your employees tested. I appreciate that. I just had another question. In Hawaii, I'm signed up for a program. It's called Aloha Safe, and what it does is if you get exposed, it will let you know that you've been exposed. Is there? I believe there's a program like that that's available or that's being run in Colorado. And as far as I'm thinking that they integrate and so they communicate with each other. Would that be accurate?
Yeah. No, it wouldn't be accurate. My guess. We had very difficult time just getting the vaccine status of folks who went across the border in our bordering states and had to move mountains to get that information. So I highly doubt that states are communicating that level of information, particularly one so far away. But we do have that program here. The governor started that November, December, maybe of last year. I can't remember exactly when, but basically it does the same thing that once you register yourself and you know, it's obviously through pings through your phone, and it knows if you are have been exposed to someone. But back to my point earlier about testing, people who are home testing, they wouldn't be a known case to the state because they've tested at home and haven't shared that information as required by law. So that's proving to be more challenging.
Would it be a good idea for us to get our employees to get on that program?
Oh, absolutely. Yeah. I mean, to be quite frank, everyone in this country is already being tracked. It's called your cell phone that you've chosen consciously to carry with you. And so what the program is merely using that technology that you're already subscribed to run the program. So there's no invasion of privacy. Everything else on their phone is a complete invasion of their privacy. This one is not, because it's anonymous. It doesn't tell me, hey, Tim, when you were in the store, you went by Chip, who is a known positive. I mean, it doesn't, it just says you may have been exposed and give you that level of information only. So definitely worthwhile.
What is the name of that program in the state? Do you know?
I don't remember off the top of my head. I'd have to look it up.
Tim, I got you covered.
Okay.
Oh, that's not the right link. That's a housing study. It's called exposure notifications. I believe it's embedded in Android and iPhone software. It's just about going through your settings.
Yeah,
Okay.
exactly.
And there's info about it. And then that other link, if you want to read a really great report about our housing challenges, you can read that one too.
So here's if somebody says that they've had a reaction to vaccines in their life, and that's the reason they don't want a vaccine, well, what is an answer to give? I mean, is this something, and I'm not going to tell you who it is, but it's somebody that lives with me and is very close to me, and you know, talking about unvaccinated people in the house and things like that. Yeah, is that something to be concerned about with this vaccine?
No. So if somebody has a known anaphylactic reaction, and that means they're allergic to something in the vaccine, like some people are allergic to penicillin, for instance. So they wouldn't get a vaccine with penicillin in it. What we do, Mike, and we address this in the interview with individuals, if they have a history of a reaction to vaccines in a life-threatening way, I'm not talking about sore arm or fever, or headache, or any of those sorts of things. Those are non-consequential from a clinical perspective. If somebody has an anaphylactic reaction, meaning they're allergic and they could die if you don't treat them, That's why we have nursing staff on hand. They have basically a shot of adrenaline, which is more than sufficient to overcome any sort of reaction the individual may or may not have. Now, granted, to date, we've had given out over 8,500 doses of the vaccine. And we have had people who come and show up and say, I have a history of bad reactions. After talking through them with them, it turns out they didn't have any reaction to this vaccine. So I don't think that's a reason to not get vaccinated. Your risk of getting hospitalized or dying are 25 times what it is for a vaccinated person. I'm not willing to live with those odds. And so I think most people, once they fully understand the real risk of COVID, any potential side effect or symptom that you may have from the vaccine is, in my opinion, it's non-consequential at all. It doesn't even rise to the same level. We have something to address that issue if it comes up, but of the 8,500 doses we've given so far, we haven't had a single one, even with people with history.
Okay, thank you. All right, we've got about 10 minutes left, and I want to get to Cheney. She's been with us, listened to what's been going on, and if you haven't met Cheney yet, they are with, she owns Studio C, which is the group that's doing our downtown master plan. Cheney, you have some updates and things you'd like to discuss with this group?
Hi, thanks everyone. Just a quick update. We finalized the Design Charrette and Downtown workshop on June 30th and July 1st, just right before the 4th of July holiday. We had some rain that was unfortunate for the event, but I feel like we still got good feedback. We were set up in Tommyknockers and the coffee shop, and just got people passing through. As Steve said, still lots of people there in the rain, so I feel like we didn't miss out on a whole lot of people. We got good feedback. We have 135. We've closed the online survey. They were available and sent to every resident of Idaho Springs in a paper copy as well. I think we had 109 fill it out online, and then whatever the rest of them, 20 some handed in paper surveys, which I manually inserted into the database to get the data. So 135 responses, which we're pretty happy with. And so our team is taking all of that feedback and working towards a draft plan, which we will circulate to this group in the city by our intention is by mid-September. And then we would then schedule a meeting in September with you all, whatever the next meeting is, to take your feedback in person. We'll meet with I need to talk to Andy and John to set these up, but we'll set up planning commission and city council meetings. And then it looks like we're on track to be at the city council meeting on November 22nd for adoption. I know you guys are all super, focused and busy with the parking structure, which is all great, and we're listening in on those and taking that into consideration. But we will have a plan that delivers a plan for everything else in downtown to improve, including Minor Street Marketplace. Obviously, alternatives for that was a big part of the plan. We developed a few different alternatives and are working towards a preferred alternative with the team now. So we will take this. Good to hear all of the conversations about, wanting to have the seating be attached to the buildings and things like that, with circulation in the middle. So we will look at all of that as well as the ADA requirements. But that's our plan. So we'll keep you updated and plan to have a meeting with you all in September to go over all of the plan recommendations and get your feedback.
All right, any questions for Cheney?
Oh,
All
I
right.
did want to ask, if you don't mind, can I ask one question? So one thing that came up in a lot in the write-ins of the survey was, and I'm writing this into the plan, but I would like to know what you guys are already doing to give locals an advantage. So for example, I went to the coffee shop before our meeting and she was asking what I was up to that day. And I said, I'm working on the downtown plan. She said, oh, well, next time tell me and I'll give you a 10% discount or something like that. Is that and or send me any ideas that you have. It is a major concern and probably not news to you, but I think it would be valuable to include in the plan some ideas that really lift up and celebrate locals, like giving them discounts and free parking. So open up to give me any programs that are already in place that I am not aware of or ideas.
All right. Okay. Thank you for that, Cheney. Does anybody have anything to share with Cheney? Okay. All right, we got a couple minutes, just general roundtable. Any thoughts that we just want to throw out there? Chief, do you have anything, or Danny from our interstate parking?
Yeah, I mean, I can give just a general update over the weekend. The traffic in Idaho Springs, we're seeing, a heavy pickup, not just over the weekends anymore. It's almost 7 days a week. So very, very busy Monday through Thursday, Friday, Saturday, and Sunday, very heavy traffic. We, are really trying to push the people who are circling for those spots in Main City and on Minor out to busting. You just get a lot of people who really, really want to park right where they want to be. So that's kind of our biggest challenge that we're currently seeing. But yeah, Idaho Springs, it's where everyone wants to be. So.
All right, any questions for interstate? All right. Anything else from the group that you want to share or get some clarification or just some general thoughts? Linda's on with us, and she sent me a text that she wouldn't be able to speak. She could only listen today. So thanks for being with us, Linda. All right. If nobody has anything. Yep, Chip.
I just really quick shout out to Dr. Boland. My sister's been visiting from Arizona and she had a medical challenge. Dr. Boland went down to her office at 7:30 in the evening, spent till like 10:30 at night with my sister. I just wanted to give her a shout out in front of everybody. She was just wonderful.
My pleasure. Thank you, Chip. I hope she's doing better.
She's doing a lot better. Thank you so much.
Okay, group. Good meeting. You always have mine and Andy and John's phone numbers or emails. If anything comes up, please let us know. Oh, one last thing, Steve, if you didn't notice, we did get one of the tall barricades down at 14th. I think we're going to put a little flowers on them, and I think they look much better than. And if you see any rapid grass flyers out there hanging on barriers, please grab them and pull them down. I know, they went around and put some out. That was fine, but if you see them, just remove them. Okay.
Hey, it's Carla. Sorry, I had one question. If there's an opportunity to get any more flowers, is it possible to put some on the corner of 13th and Minor where the school is? That corner is looking kind of funky, and or I can talk to Karen about trying to get some flowers in there. It's that median. It's not a median. It's sort of the edge of the sidewalk right at the corner in front of the school there.
John, any idea on that, John Payne?
Steve, if I could come, we had talked about grabbing those barrels. If I could come over and get one, I have dirt. I just have to go to Home Depot to get flowers.
And do.
Thanks, guys.
I'll come play in the dirt with you.
All right, that sounds good.
All right. Okay, well, thanks, everybody. Reach out if you have anything or any ideas, and we will see you in 2 weeks, if not before.
Bye.